When they first told me that I had a DVT, initially I didn't understand what it was. It wasn't until another physician came up and said, "I'm not sure you understand what that means. You could die." And that took my breath away.
Deep vein thrombosis, also known as a DVT, is a blood clot in your veins, and you usually present with symptoms of pain and swelling in your legs or your arms. If this blood clot moves and goes to your lung, it's then called a pulmonary embolus, and that can also cause shortness of breath, chest pain, and in really severe cases, death.
I had chronic blockage in my left leg, and every time I would try to exercise, it was hard because my leg would swell up and I'd have a lot of pain. But I just thought, what is going on? There's got to be another way.
Peggy had been treated someplace else a number of years earlier. When I looked at her leg and I looked at the imaging, I said, I think you need one more stent, and that'll treat some blockages that either developed over time or weren't treated during the first procedure. Venous stenting is a technique that was pioneered here at Stanford. We clear away all the clot, and then we often put a stent in there. And the stent then is a metal tube that goes inside the vein, stays there forever, and opens up the vein and allows the blood to go through.
I had a complex case, and Dr. Hofmann found solutions that worked for me. I felt like he truly cared about me, as the individual.
I really listened to what's important to the patient and what their goals are. We see a broad spectrum of cases at Stanford, from relatively simple and straightforward to very, very complex.
It felt right to go to Stanford. Not everybody specializes in DVTs, and Dr. Hofmann is the expert in the field. I feel confident about my path forward, and that's because of him and his team of people.
When patients come, the most important thing is to give them hope. Very, very few patients we can't help. So whether your vein has been blocked for 5 days or 5 years or even out to 20 years, we have techniques and technologies to treat them.
The results that Stanford provided have been a life changer really for Peggy and for our family. It's given her the ability to do the things that she loves.
I'm very grateful to have an amazing team in interventional radiology at Stanford. With the new hospital opening up, we have new capacity, new rooms, new technology to continue to take care of our patients the way we've always had, but also be able to continue to push the limits of medicine to try and figure out what new things that we can do to help patients.
It's been awesome to continue to do the activities and things that my family loves to do. And it's just made a world of difference in terms of my lifestyle. I'm so grateful